Welcome back to another episode of Monday ReTsene with Pretoria Psychologists. This month, we are tackling the topic of demystifying mental health illness. In this topic today, I will not necessarily be speaking about a specific mental health illness, but rather equip you with a tool to understand where you are with all mental health illnesses. This tool is called mental health literacy. So firstly, let's start with demystifying. What does demystifying mean? It basically means to take something complicated and explain it in a way that is easy to understand and that ensures clear and precise understanding. So what is mental health literacy in this regard? Mental health literacy refers to an individual's knowledge and beliefs about mental health disorders that aid in their recognition, management, and prevention. So this is really important. Mental health literacy can often result in a reduction of stigma, and the reason this is because, for example, when you have an understanding about mental health illnesses, you then are able to work from a place of compassion and empathy rather than a place of judgment. And so we often see that in communities that have high levels of mental health literacy, that there is a reduction in stigma. Secondly, there's more social inclusion with regards to how we treat people with mental illnesses and mental disorders. And also we see an increase in help-seeking behaviors. So today, for majority of the episode, we will be unpacking what mental health literacy is, and at the end, I will contextualize with a small example around depression. So, a reminder that the definition for mental health literacy is the knowledge and beliefs that we hold as individuals about a mental disorder or mental disorders that aid in our recognition, our management, and our prevention. And therefore, it is a threefold definition: recognition, management, and prevention. So let's start at the beginning. With mental health literacy, the first key thing to understand is it is about how we recognize mental disorders and mental illnesses. Are we able to name their symptoms? Are we able to realize the emotional and behavioral impact that it has on us as individuals? How it affects people, how it affects families. That is really important and is the first step in mental health literacy. So for example, in our mental health, there are three main sort of categories that impact us. The first is mental distress. Now, mental distress refers to a normal emotional interaction or reaction rather to a stressor. Those emotions are often temporary. So for example, if you're nervous before doing a video shoot, or if you're nervous before taking a test, those are normal reactions to life stresses. So that's the first classification, mental distress. And we all go through different forms of mental distress. The second one is mental health problems. So mental health problems are basically when the problem that is causing the emotional impact outweighs the resources of the individual that will then make it more difficult for them to deal with the problems. So for example, if I struggle to pay my children's school fees, that will cause me stress and emotional distress, but I also do not have the resources to ensure that that problem is no longer a problem. And therefore, we start to look at the disparities between what is the problem and what are my personal resources in order for me to cope with the problem. And lastly, a mental disorder. So we would need to understand what is a mental disorder. A mental disorder is firstly diagnosable. Now this is really important because a lot of us self-diagnose. A lot of us are very quick to put a label on the emotions we're feeling. But in order for it to be diagnosable means it needs to be diagnosed by a mental health professional. Somebody such as a counseling psychologist, clinical psychologist, even a psychiatrist will be able to diagnose mental health disorders or disorders. Now, what's important to understand is that when we make the diagnosis, we make a diagnosis via a classification system. Therefore, that means it's standardized and it has come through the necessary testing and scientific classification to ensure that we are not over-diagnosing certain mental illnesses or disorders. The second part is that when you say you have a disorder, you have to acknowledge that it has a negative holistic impact on your life, whether it be socially, occupationally, and in any other important area. So for you to say I have a mental disorder, firstly it needs to be diagnosed by a mental health professional. And we need to acknowledge the negative pattern it is having holistically on your life, right? So we've just covered the three sort of facets of mental health and some of the distress that we may be feeling, being mental distress, mental health problems, and mental disorders, all of which can occur in each individual at different rates, and we all experience it at some point or the other. The second aspect of mental health literacy is to recognize the cause and the risk factors related to a mental disorder. So for example, a risk factor within depression is that suicide ideation takes place, which means that there's an increased risk for suicide when you have been diagnosed with depression. And it's important that we are aware of it, that your family is aware of it as a support system, and that you are aware of it as the individual. What's also important to note here is that when you talk about the cause of mental illness, a lot of people have beliefs around mental illness, and this is where what we call intersectionality takes place, because all of our beliefs are informed by religion, by culture, by society, which means that we may not necessarily have the most facts around how we view mental disability or illness, and therefore it's important for us to reflect on what actually informs our beliefs about mental health. The third component is self-seeking or self-help behaviors, help-seeking interventions. What does that look like? So the first thing is, if you have now acquired the knowledge about how to recognize a mental disorder or illness, and then how to identify risk factors and causes, you then would need to put an intervention into place, right? So that's management, or what we would call prevention. So management has to do with, when do I seek help as an individual? When has the problem become bigger than my capacity to deal with it? And then, now that I know I need help, do I have the information with regards to where I need to go seek help? How do I seek help? Who do I go to? Is my doctor the first point of call? Often you can go to a GP and they will therefore refer you, but having the information that this is actually a psychological problem streamlines your process for intervention, which basically means that you are able to go directly to the professional that meets the need that you present with. So for example, I like to use, if you have a problem with your teeth, you don't go to a medical doctor, you go to a specific doctor, which is known as a dentist. The same can apply to psychology and psychological issues. Secondly, we've talked a lot about self-care, a lot about self-helping behaviors. So, on our channel, there's a lot of information around self-care, resilience, and things that we can actually do on a day-to-day to help manage and prevent mental health disorders. And the last thing I want us to talk about is self-advocacy. Now, this is really important because it has to do with how we communicate what we're feeling, our symptoms, what we may be going through. And often if we lack the understanding, we find it very difficult to communicate. And so this is where knowledge becomes power. This is where we are able to say to a professional, this is what I've been going through. You may not necessarily have the correct terminology. So you may say, I'm sleeping more, as opposed to saying hyper insomnia or hypermania and things like that. That's okay, but it's being able to describe what you are actually feeling at that point. Because what that also does is it empowers you to be assertive in your experience and to validate your own experiences with mental health challenges. The last aspect is your knowledge and beliefs about professionals. So for example, the main myth around going to see a psychologist is that if you go see a psychologist, you're crazy. And that's a myth. Because the fact is, you can see a psychologist for many different reasons. You could see an educational psychologist for subject choice and career guidance. You could see a counseling psychologist for depression, anxiety, going through a divorce, a traumatic event. And obviously you could see a clinical psychologist with regards to slightly more intense diagnoses such as schizophrenia, your bipolars, etc. But it becomes important to realize that if you hold the perception that going to see a psychologist is only for crazy people and you do not want to be viewed as crazy, you are not likely to pursue the help that you actually need. So as I promised, we will be quickly using an example to contextualize mental health literacy. So that, for example, is depression. Now, depression is thrown around, the word depression is thrown around very casually, in casual conversation, socially, and it's also used to describe any form of a stressor that makes you feel sad. And that is not necessarily true. So how do you differentiate between sadness and depression, for example? Sadness is a normal emotion, first and foremost, to a stressor that may be making you feel upset, but it also is something that is temporary, something that is varying in degree. Whereas a diagnosis with depression has to do with being diagnosed by a professional, but also the actual symptoms. Hopelessness, suicidal ideation, weight gain or weight loss, sleeping too much or too little, feeling irritated, something we call psychomotor agitation. All of those would need to be present to a certain degree for it to be diagnosed. And I think that's where we need to differentiate between normal emotions such as sadness versus actual depression. And again, this has to do with your level of mental health literacy. Now, what I want to stress in this video is that mental health literacy is not something that we're born with, but it means that we can therefore create a high level of mental health literacy should we take the responsibility to start educating ourselves, listening to such videos, for example, as a part of psychoeducation. All of that will start to build your level of mental health literacy. So here's an example. An old woman who takes care of her parents who are elderly, who are sickly, may feel saddened by the fact that her parents' life is coming to an end. However, if she is able to still enjoy and meet the expectations of her role as a mother, as a churchgoer, as a caretaker, it is likely that she is actually experiencing mental distress or a mental health problem, as opposed to depression as a diagnosis. And the reason I say this is because in other aspects of her life, she has maintained her level of functioning. A diagnosis, and especially a mental health diagnosis, means that there has been decreased functioning in more than one aspect of your life to the point that it's having a negative impact. Today's session is purely about understanding that with any mental illness, we can then assess where is our mental health literacy, how can I increase it, and where can I seek help. For example, if you start to realize that you may have some signs of depression, where do you seek help? Like I said, you can go to your GP who would refer you on. There are free counseling services online, some of which are toll-free, Lifeline, SADAC. Seeing a psychologist is important. At universities, they have student counseling centers. Some firms have psychologists that are on board to assist. So it becomes important for you to understand where you get information. Other places, for example, discount pharmacies have QR codes that you can scan that will give you information on specific health conditions as well as mental health conditions. This is a form of trying to build mental health literacy and also psychoeducate. I do believe that there has been a shift towards increasing mental health literacy, and I'm a firm believer that knowledge is power, and that when you multiply that knowledge, power increases. And it's important that we start empowering our communities. Overall, I do believe that there's been a shift and a concerted effort to increase mental health literacy via psychoeducation platforms and things like that. For example, at discount pharmacies, there are QR codes where you're able to scan the code on your phone and receive certain information. So there are a number of initiatives. The Monday ReTsene Pretoria Psychologists initiative to have a psychoeducation platform is one of them, just to ensure that we are building mental health literacy. And it's important to understand that we can build mental health literacy with regards to very specific mental health disorders. So for example, depression, anxiety, those are the common ones. But it's not the only mental health disorders that are experienced within our communities. Postpartum depression, for example, bipolar 1 and 2. So having information to equip and increase your mental health literacy is extremely important. The main aim of today's session was to emphasize that firstly, you can build your mental health literacy, and that is something that is an ongoing process of education and understanding facts about it, but also that knowledge is power, and that knowledge, when multiplied, means that power is then multiplied, and it's about empowering yourself. In today's session, we didn't necessarily do a deep dive into a specific mental health disorder, but what I hoped we would get across is that mental health literacy exists across the spectrum of all disorders. And if we start to increase our mental health literacy across most of the disorders, we start to empower ourselves and our communities. Join us next week for another episode of Monday ReTsene with Pretoria Psychologists.